focused on coccidioidomycosis, covering epidemiology, clinical presentation, diagnosis, and treatment indications with detailed explanations. Question 1, Epidemiology and Exposure Risk. A 29-year-old archaeologist returns from a dig site in Arizona and presents with fever, fatigue, dry cough, and joint pain. Examination reveals tender red nodules on both shins. Chest X-ray shows right lower lobe infiltrates. Which organism is the most likely cause? A. Histoplasma capsulatum, B. Blastomyces dermatitis, C. Mycoplasma pneumonia, D. Coccidioides, E. Cryptococcus neoformans. Correct answer D. Coccidioides. Explanation: Coccidioidomycosis is endemic to southwestern U.S., e.g. Arizona, California. Dust exposure, especially from soil, e.g. archaeological digs, earthquakes, increases infection risk. Presents with respiratory symptoms, erythema nodosum, desert bumps, arthralgias, desert rheumatism. Why not the others? A. Histoplasma, endemic to Mississippi, Ohio River valleys, not Arizona. B. Blastomyces, seen in Great Lakes, eastern U.S. C. Mycoplasma, atypical pneumonia in young adults, but no nodules or desert exposure link. E. Cryptococcus, usually in immunocompromised, often with meningitis, not erythema nodosum. Question 2. Histopathology and identification. A lung biopsy from a patient with fever and pulmonary infiltrates shows large spherules filled with small endospores. The organism is significantly larger than RBCs. Which of the following is the most likely diagnosis? A. Histoplasmosis, C. Coccidioidomycosis, D. Cryptococcosis, E. Aspergillosis. Correct answer, C. Coccidioidomycosis. Explanation: Coccidioides exists as spherules filled with endospores in tissue, not yeast. Size is much larger than RBCs, a key histological clue. Why not the others? A. Histoplasma intracellular, within macrophages, smaller than RBCs. B. Blastomyces, broad-based budding yeast, same size as RBCs. D. Cryptococcus, narrow-based budding, thick capsule, often in CNS. E. Aspergillus, septate hyphae, not spherules or endospores. Question 3. Dissemination and treatment indication. A 38-year-old man from Southern California presents with 2 months of cough, weight loss, and joint pain. Physical exam shows erythema nodosum and skin lesions on his neck. MRI of the spine reveals osteomyelitis. Coccidioides is identified from a sputum culture. What is the best next step in management? A. No treatment. Monitor only. B. Start fluconazole orally. C. Start itraconazole orally. D. Start amphotericin B intravenously. E. Start rifampin and isoniazid. Correct answer D. Start amphotericin B intravenously. Explanation: Disseminated coccidioidomycosis involving bone skin requires systemic antifungal therapy. Amphotericin B is the treatment of choice for severe disseminated disease. Fluconazole, itraconazole can be used in mild to moderate or chronic forms. Why not the others? A. Monitor only, not appropriate for disseminated disease. B.C. Fluconazole, itraconazole, used for non-severe localized infections. E. Rifampin, isoniazid, anti-tuberculosis drugs, not used for fungal infections. Would you like a